sort of gone through and line item, person by person, came in, sentence, length, and we spent a lot of time with auditors sort of going through the data, looking at that, and seeing how long folks were there and sort of verifying that. So, one of the things that I think has been useful in all of this is that it's sort of bringing together, folks from a lot of sort of different areas to sort of work on the problem all together. The folks from Safe and Sound, the contractors they've hired, the departments have all sort of been heavily involved, and it's sort of the buy-in that they have that really sort of I think sort of drives it. I mean, if they don't have the buy-in, it's hard to say that a program like this is going to be able to, one, be successful, or two, even be considered. Because if the department isn't really interested in doing that, it's just not going to work. So that's sort of where we've been. So, like I said, one of the things that we've seen, it does take a long time to sort of get through these cohorts. As a state, we've been pleased. We've done 4. Another thing that seemed to hurt it. I mean, it seems that when we've sort of done these estimates of how many people would participate at the start, it's probably been a little bit less, or going a little bit slower than we'd like, and probably than everyone would like. I think from stuff John was saying and Judy was saying, there's very much a lot of similarities with the social impact bonds. With the main difference being that there's sort of not the repayment, there's just the to the investors. There's the commitment from the state that if this works, we're going to continue the program forward.
Thank you. So I want to thank all of the presenters and move into more of a discussion and exchange. But I want to take the prerogative of being the facilitator to ask John, you may have gone over this, but it's not clear to me what the theory in SIBs is about how the funding continues to be there over time to maintain the intervention or the initiative. I'm wondering if you could address that.
Yeah, so we're still at square one, and I don't think we've quite gotten to the point of thinking about how things get sustained. I think at this point the way things would get sustained is that you'd have to continue to do additional social impact bonds. Part of the reason why I'm pushing infrastructure development rather than sort of one-off programs is exactly for this point, which is that if you fund infrastructure, then the sustainability mechanism is built into the initial funding, and so you've got something there that you can then run. I mean, I'm still struggling with being a purveyor of neoliberalism, I think part of the point that I want to make though is that when I listen to Mark talk, or Vinnie Schiraldi or Marty Horn, or these people are rare, right? And Liz. And so if we want to do things that are really innovative and reformative, and do the things that you want to do, and get government out of doing, out of the business of remediation and into the business of prevention, which I think we all want to do, that you need a mechanism that creates, that does it in spite of government, rather than along with, but in spite of, right? And create the infrastructure so that at the end of the day, you can say to them, look, you've got this network of community-based residential treatment for high-risk adolescents. Why would you send them to secure confinement? You already built it, And even the most sort of inertial government is going to have a lot of trouble, not seeing the logic in that.
So I think that Mark described a rather robust planning process, and I'm sure it wasn't an accident that the meetings were held in a facility as opposed to a foundation office. Knowing HATHAWAY, that's pretty astute. But I'm not, and it sounds like there was a lot of participation of government and official players in doing the analysis and figuring out what the target of opportunity would be and what the intervention would be. Is that being, is that what's happening in these states that are looking at implementation of social impact bonds?
So somebody asked me this question the other day. So and my take is that what we are, I think Mark, one of you used the phrase charismatic leader or something like that. And we are clearly right in the middle of the charismatic leader phase. And there is somebody somewhere, either in government or at a big national service provider, or at a foundation who really believes in this concept, or in government. And you see it here in the state, you see it in the city, you see it in DC, and it's really charismatic people from some player in the system who are really driving this forward. And I think what Mark said, it takes a long time, and I think that's the way these things always start. That's how drug courts started. I think every sort of large-scale reform needs lots of pilots to get to the point where it becomes sort of a part of doing business.
Thank you. So, questions or comments from the floor? We need to use the mic, if you don't mind. Steve?
Okay.
And introduce yourself.
I'm Steve Ginland. I've worked in the system in various ways since 1963, and I'm hoping we can hear from someone who knows what's happening in New York City. Liz Gaines was here and may have escaped. But if there's someone else here who could say, I mean, we've had this wonderful word from the beautiful state of Maryland, but how's it going here?
Hi, should I come up?
Yeah, sure.
Okay, so I'm Cindy Redcross from MBRC, and we are the, as John described, the intermediary in the Rikers, what we're calling the Rikers SIB at MBRC, and things are, they're going. It was difficult. I can sort of step back, and I don't want to go all the way back to the beginning because I wasn't so involved. But we did, John described what the ideal role of an intermediary would be, and we pretty much played that part. The city did approach us with an idea for a cognitive behavioral intervention, and we picked up on that idea, looked into the evidence, and chose MRT because we knew the program was going to be implemented at Rikers, which is a high turnover, short stay, very dynamic kind of environment, and the program needed to be able to accommodate sort of people coming and going. It needed to be less structured. So that's how MRT was chosen, and MBRC did have a big role in helping the city decide upon the intervention. There was a lot of time spent in the beginning getting the contracts in place. There was a lot of unanticipated expense and effort, negotiating with all of the various organizations. I mean, MBRC is not really, we're not a law firm. So we ended up having to hire a very expensive law firm to help with the negotiating process. I mean, that was kind of unexpected. Let's see, there was a lot of back and forth about the evaluation because we, MBRC, we do a lot of different things, operations, but we're very serious about evaluation. That's our thing. And Vera is the evaluator, which Chris is here from Vera. And there, we really tried to, we ran a pilot, we tried to implement, or Vera tried to implement random assignment because, we thought that was the best way to show program effectiveness. It just couldn't work. I mean, it's just, just because of the way the dynamics work in Rikers, it wasn't possible to pull off an RCT. We took a lot of time to figure that out during the pilot of the program. So after a year or so trying to do random assignment, Vera ended up coming up with a terrific alternative design that we can feel confident in. Let's see, the program is doing, we're just starting to enroll what we're calling the evaluation cohort. So the program's been operating in Rikers. There were a lot of things to work out. It was, I would, if you can add anything, you really should. But it's now, how long is that? It's been operating over a year.
July.
Okay. So it started, there were some people that were getting services during the RCT trial as well.
Oh, yeah.
Yeah, so that. Right, it started, that's a good point, actually, I forgot about that. When we first started running the pilot, it was being run, the intervention was being provided by the teachers from the Department of Ed who are at Rikers. And that was an important discovery that model just really can't work. Teachers are not trained, they're not prepared, they don't, it's not their job to provide this kind of MRT programming. So in July, Osborne came on and had to hire additional staff to cover the take over for the teachers. So and Osborne's been working out the kinks. There's space issues. There's kind of tension between the corrections officers and the Osborne staff, and there's a lot of political back and forth. And it was a difficult half a year. But now we feel like MDRC is out there pretty often, as well as the MRT technical assistance provider. We're out there pretty often monitoring what's happening with the interventions in the classrooms. The way that MRT functions, the participants go through steps they have to complete. They have to do testimony, and then they move to the sort of the next level. They're not progressing the way that we would have anticipated. They're moving, they're moving more slowly.
Carolina with the Osborne Association. Just a couple of things, because it was described earlier as high dosage, and it's and reentry, and I wouldn't say that it's either one of those things. It is an intervention on Rikers Island for every single adolescent, which is wonderful. But we're serving 3,000 people a year, and the adolescents come home. And it's not the kind of holistic approach that you were talking about in Maryland. It's not that. So as excited as we are, we'll see. What difference does one intervention make on the island? We'll see. But I think it actually, in spite of the size of it, it falls short of filling all of the needs of the young people.
Thank you. Thank you. Jeff?
Jeff Butts from John Jay. And I have a question that's always bothered me about the social impact bond method. And John, you alluded to it but didn't address it in your third question, second bullet. And then it came up in Hathaway, which is, and it might be one of the biggest character defects in our political and economic culture, is we see all crime problems resolvable through individual solutions. So we take social problems and see them as a function of individual defect. And Hathaway, you mentioned this, that the solution to crime, especially if we're into prevention, is not more therapy for everyone and more individualized treatment. Sometimes environmental solutions, place-based solutions, and John, your second bullet said something like that as one of your ifs. Can we adapt this model to address place-based solutions, environmental programs, collective efficacy approaches? What's your view on that? You said that you haven't resolved those questions, but what's your expectation?
Well, I think, it's a very flexible model, and I would like to think, and the people who are thinking about it, like we discussed, are sort of the charismatic leaders, the progressives, the innovators, the neoliberal purveyors of buzz. I'm going to quote you a lot, because I loved it. And I think people are open to new ideas. So I think I agree with you entirely that we miss a lot when we think about an individual with a diagnosable problem as being the core of why this person has the status and standing that they have. I think that just misses the whole point. I like things like MST, where you have the kid out in the community and their real world, and but even that doesn't go far enough because you're not thinking about the community and how you want to address the community. I love this program in Philadelphia that's being run with the Philadelphia Horticulture Society, where they are greening the 45,000 vacant lots in Philadelphia, and they're doing it in a really smart way, where they use spatial mapping to think about where you can stand and see the most of these places, and they do those blocks first, and they turn them into community resources that the community can use. And I said, this is, this is perfect for a social impact bond. It's absolutely perfect because it gets us away from, we're not trying to be in Rikers Island where it's, you have a million impediments and the correctional officers, just care about safety and they don't want you there. And, we don't have the right assets and we have people coming in and out. We don't know where anybody is and we don't know how long they'll be there. And, and if you agree in a community, then you can change norms in that community and you can have all sorts of effects. Just one last thing. The power, you can see the power of this in Washington, D.C., not in terms of the greening stuff, but the idea of the importance of place. So in Washington, D.C., 5 years ago, there were about 200 homicides in D.C. And today, there are 88 last year. And Prince George's County, where a lot of people got dislocated by gentrification, also has fewer homicides. And that suggests to me very strongly that a lot of what's going on when you think about offending behaviors is about the places where people are, not about the attributes of the people in those places. The place poisons the person. If we fix the place, we can help to fix the people. It's not perfect, but it's part of the answer. And there's no reason to me why this investment vehicle isn't a way to get the kind of funds that you need to do that sort of grand scale change.
Follow up, or are you satisfied? Jeff, also Jeff.
Jeff Mello, John Jay College. So I'm really confused about the financing of all this. And if this does go to scale, I mean, this is all going to be institutional investors, right, purchasing these bonds. They do want to return on their investment, right? Then doesn't this just become a transference of money from the government to the institutional investors? And all these programs and all these projects are going to have to get rated because, as you said, Moody's, right? So it's going to be like muni bonds, right? It's going to be AA and single A and a B. And I'm just concerned about the subjectivity, knowing what I do with doing evaluation research on how we really are going to be able to rate these programs. And I just don't see, I see problems going to scale and getting institutional investors behind this.
So I'm going to go like this because all of my panelists agree with you.
I was going to say, can you spell junk bonds?
Yeah. So, okay.
And one failure will make this whole thing impossible.
Okay, first, they're not bonds. They'll never be bonds. They're just contracts. It's just a contractual arrangement, right? They call them bonds, as you said, because that helped create the buzz, right? This comes out of the venture capital world. They wanted the buzz. That's why we call them that. That's the first thing. The second thing to say is, I think that what we're transferring first is the risk, then the capital. The problem with coming to places like this is you guys get, myself excluded, the most interesting people doing interesting stuff, and we forget sometimes that out in the real world they're not doing any of this stuff, and they're scared to death, and they don't want to, they don't want risk at all, right? So if we can transfer the risk, then we can worry about transferring the capital later. And then the final thing is, I am more. So I got interested in this whole idea because there was Recovery Act money in Washington, D.C. to replicate the Washington State Institute of Public Policy to build a meta cost-benefit model, and we got that money and we did it, and at the end of the day we could say, wow, you should do this and this and that, and I can tell you, I could show you what kind of product you could generate with this. That gets away from saying what is the average effect of something to what is the probability that something will be successful. And we can do that now and put that probability on it. And you can go to a government and say, if you do electronic monitoring instead of short-term jail stays, you will save this much money, but there's only an 80% chance that the benefits will be greater than the cost. And I can use that to price the bond and tell them what their risk is and what the uncertainty is. And then the marketplace begins to determine how much they're willing to invest, how much profit that they need to get back to take that risk that you have to quantify. So I think you're right. We have to get to the point where we quantify risk better, where we get away from average effects and talk more about probabilities. Because all this meta-analysis is great, but the reality is, you're going to do one thing in one place, and you could be anywhere across the distribution of possible costs and benefits of doing that program. So we have to be very transparent about all of this stuff, or investors won't invest. And my last point is, the first investors in this thing are going to be entrepreneurial-minded philanthropists, the Rockefeller Foundation, Robin Hood, all all these groups are the ones who are really backing this at the moment. And the idea for these folks, the Cleveland Foundation, the Gun Foundation, for these folks is the idea that they can get that there's a chance that they can get some of their dollars back and leverage it and use it again is really compelling, right? Because there aren't a lot of ways they can do that. So I think there are a lot of those folks out there, and there's enough to get this thing started. I'll stop.
Oh, no, I didn't want to stop. We're just kind of signaling each other. I actually want to ask Mark a question, and then I think Hathaway has something to add to this. You know, I've realized over the life of my career that part of getting better at what I want to do is learning how to talk to people who have a different, view of the universe than I do, who have a different set of concerns, a different set of interests. So in this case, I'm particularly interested in your insight and your guidance, Mark, on how we can talk more effectively to the budget people, particularly the ones that aren't already in Maryland or already in New York, who we think John thinks are perhaps in a different place than the other 48 states. I mean, is there like a short version of how you frame this conversation or how you approach it to get some traction?
Well, I think Hathaway and I were talking about this a little bit earlier. I think part of it really is sort of the buy-in with multiple sort of stakeholders. I mean, it's just generally very hard just to bring a proposal to the budget department and say do this, because the budget department, most budget departments, we deal with the dollars. The agencies are the ones that deal with the policy, and they're the ones that know the programming and the research. And so I think their involvement is sort of critical to, bring forward any proposal.
Hathaway, do you?
I want to just
Into the
ask,
mic,
ask
please.
people to reflect on why they want to do one of these things, and not look at it necessarily as a financing tool and is it going to be good for investors and how do we give them probability and boom, boom, boom. I mean, all that is very important. But where we start from is there are policies in our country, in our states, that are just wrong. I mean, if you look at who's in these prisons, they're African American primarily. So ask, what is that? Is there something bad in the water in African American communities that make them criminals? Or, what's going on? Because if we look at this as a better way to provide upfront funding to serve people who, in my opinion, have been fundamentally discriminated against by not having opportunities in their community, yeah, we can make this marketable. But it's almost, if I'm making any sense, offensive to think we can sell the government's failures at a deep end response to injustices in our community as a really good deal for people that want to make money to invest in it. So really, if we were going to be very scary about this, the worse off we can treat people and get more folks into these systems. If my buddy is a really, rich guy that might fund my race for president, I mean, you can really, it's almost, and I don't want to be too much of an alarmist, but the more I see of people's lives, it's a scary little thing to just talk about this as financing tool or blah, blah, blah. And just one thing is to think of the word prevention. And we don't use that word, and I actually have a little paper here that adds a little footnote. In public health, it's very important, but in social stuff, I have one child, and I did not put her in a single prevention program. I didn't think she was going to be a hooker. I didn't save my money. She wanted to dance. She danced because she loves to dance, not because I was afraid if she didn't dance, she'd go get pregnant. And I think this point of view that in poor neighborhoods, people need to be prevented. So we have midnight basketball, we got all these things. But the very term, and to go to the state legislatures, it's like, yeah, we got to prevent them again. Well, no, we really need to prevent the bad public policies that put people in positions where behaviors forced just for survival. Anyway, I pontificate, but I would like to sort of reflect on that because this is a big, big money deal. One of our investors said to me, man, you've been doing these opportunity compacts. You got 4 of them, nobody talks about them, but we have social impact bonds, and the only one that's been done is in England, and everybody and their brother's talking about it. And I asked, well, what's the difference? And the thought was, well, maybe because it pays a benefit to private investors.
Yes.
I guess I have a question.
Could you identify
Oh,
yourself?
sorry. My name is Justinian Santana, and I work for Steps on Family Violence. I work with survivor defendants charged with crimes who have a history of trauma and domestic violence. I guess my question is a little bit about, maybe Judy can speak to this. I'm having a conflict in my mind about corporations utilizing this tactic as almost as a corporate social responsibility model, but with a return on it based on social issues that we are now allowing the government to not do anything about. And so how do we reconcile that, especially when we're grassroots agencies trying to work in communities to say to them, Goldman Sachs is using kind of this model of being socially responsible with having a return on their investment to communities that are already disenfranchised.
Yeah, that opens up a lot of interesting thoughts. One of which is that, what is the difference between a Maryland Opportunity Compact and a social investment bond? A whole lot of complexity and a whole lot of cost that isn't there, really. Not that it's easy or not complex to do what you do, but, John said something about, well, it's attractive to foundations, to think that they can put out their money and then get it back with interest. I'm not sure about how that fits the IRS structure for foundations in terms of, how much they have to spend of their endowment every year. And I'm wondering whether the Bloomberg Foundation gave the money to MDRC out of their endowment, which would make some sense, or whether it just came out of the grant pot. And are we cannibalizing philanthropic granting in order to create a huge buzz? And if it works, profits for someone. What else to say? I don't know. When did a program ever close a prison? Everything that Hathaway just said about what the problem is, both at the institutional level, all those prisons and jails, and at the neighborhood level, all the impact of decades of disinvestment and structural barriers to opportunities for Black and brown people in this country. Why would we go to a program model if we wanted to have a big impact? Why wouldn't we go to what's going on in a handful of states where they're having a big impact, and what they need to figure out is how to capture the savings? And if I were trying to capture those savings, I'd want to put them back in what Eric Cadora calls the $1 million blocks, right? Not Goldman Sachs or the Rockefeller Foundation. And, so those are my thoughts about your question.
And so we're getting to the end of our boundary, and I wanted to give John a chance to respond to that.
Yeah.
Okay, so Eric's
Mr. Neolith.
Eric, okay, first off, I don't want to
Eric loves this.
Eric is on my team.
Eric gave me the McKinsey thing,
okay,
thinking I would love it.
I don't know how I became the face of corporate greed in America. I read Matt Tiavi and Rolling Stone and laugh. I mean, so let me say this. So my concern is that I am less of an optimist than anybody else here, I think. Because the same government that put us in this situation that we have to remediate is the one that we want to partner with to fix it, and they've proven they can't do it except in rare instances. So we have to find another way, and that's what this is all about.
Oh yeah, bring in Wall Street. They did so much good before 2008.
Or make the rare instances more
But
known and more appealing.
but I think so. Let me say this is the last word. So, and I'm glad we had this fun, because this is fun.
It is fun.
It is fun. But so here's the thinking. So the thinking is, so Kippy Joseph at the Rockefeller Foundation starts every social impact bond meeting by saying, we're here to talk about social impact bonds, but know that this is just the tip of the spear, that the whole idea is to get corporations to get involved in doing socially good things as part of a change in their corporate culture where they become sort of double bottom line oriented. So there's lots of different ways to do it, right? You could do Maryland Compact, you can do human capital bonds that they're doing in Minnesota, you can do social impact bonds. There's this wonderful corporation outside of Philadelphia in Berwyn called the B Lab, and I'll wrap up on this. And they're taking the Ben and Jerry's model of corporate responsibility, and incorporating them into their charters so that corporations have to do multiple things in addition to making a profit as part of their fiduciary responsibility to their stakeholders. And you could imagine the day when New York City provides tax incentives to somebody like that to run a private prison where they have to not only reduce recidivism. I know I had to finish this. I apologize.
You had to do
I had to do this. Where they not only have a responsibility to house and protect the safety of the officers and the inmates, but they have a responsibility to deliver services that reduce recidivism, and they have a responsibility to pay their officers a living wage. And there are lots of different ways we can be creative about getting private sector dollars in to remediate some of the damage that's been done.
John, are you the person who decided that the UK SIB would be placed in a private prison at Peterborough? Right?
I have nothing to do with it.
So we're going to
I was
end
too busy with my
here.
credit default.
Yeah,
But
why?
this is just a taste of things to come. Obviously, the conversation is going to continue, although one might think from your last remarks that you are the most optimistic person today. I want to thank John, Judy, Hathaway, and Mark for coming. Please join me in thanking them. And I want to thank you for coming
Sign me
too. Have a nice day.